Hi, Dr. Flaherty. How are you doing today?
Good, thanks. How are you?
Good, good. Well, welcome. Thank you for joining us. And if you could just share with our viewers a little bit about your background.
Okay. I'm actually born and raised in Macomb County. I grew up in St. Clair Shores.
Close.
And went to undergraduate at Wayne State University, then did my residency at McLaren Macomb in emergency medicine. And now I've been an attending physician at McLaren Macomb in the emergency department for 8 years now.
Okay, perfect. Well, we hear a lot about abuse with prescription drugs, and you have a great interest in this. Why is that?
I do. Well, you know, having worked in the emergency department for over 8 years now, there's definitely been, I've seen a big increase, unfortunately, of, you know, patients coming in with prescription drug abuse issues, dependency issues, and even overdoses. So, you know, it's more of a frequency. And I think the bigger issue now is you're seeing it in such young patients. It's not uncommon to see it teenagers. You know, in fact, the recent studies show that 1 out of 5 high school kids report misusing prescription drugs. So it's affecting our younger population.
So is there something that you run into more often than others when you're in the emergency department?
Yeah, I think the prescription, you know, patients that are misusing prescription drugs. You know, whether they be provided by a healthcare provider or maybe they got them from family members. It's a very common thing we see.
Okay. So is this something that you see it more in the younger adults than in older adults? Is there a discrepancy, so to speak, in the age group?
It kind of affects all, you know, all ages. But I think it really hits home when you see the younger kid. You know, they're so young. Some of them are even junior high school and are, you know, being exposed to this. So.
And what can lead to this abuse? Is it the kids being able to get the prescription drugs in the home? Is it from friends? Is it on the street?
Yeah, that's a good point. One of the big things we try, you know, increase awareness that 70% of the time they're receiving them from family members. You know, not maybe the family members just have some leftover medications in the house, and you know the kids are exposed to that. So.
Okay, so how does this abuse manifest itself physically?
Yeah, what happens is it leads to dependency. The kids or the patients become dependent on these medications, and that leads to tolerance. And when you're tolerant, unfortunately, you require more and more of this medication, greater strengths, and then that oftentimes that leads people to look for like street drugs, say heroin, which now is a whole nother, you know, major issue. So.
So you're seeing a lot more heroin abuse in the emergency room department now? Okay.
Heroin abuse and heroin overdoses.
That just has to be very sad to see people
tough.
come in. Yeah, I understand. So what sort of measures are out there that have been to help those people with the addictions? Are there programs that they can reach out to? What can we do to help them?
Yeah, it's a good question. There are good programs out there. You know, there's support groups like Narcotics Anonymous. In Macomb County, there's Families Against Narcotics. It was actually started in Fraser. It's led by Macomb County Judge Linda Davis. And it's a great support network for those who are affected by addiction. Besides those, you also have physicians that specialize in addiction medication, and they can help assist you with that. There's medical therapies, treatment centers that can assist patients.
So as parents, is there anything that we can do more or less to make sure that our children's friends are not getting a hold of the drugs in our home, because we might not even be aware of it?
Correct, and that's the big thing. I was trying to increase awareness. And I think if you do receive, say if you had a tooth pulled, you prescribe some pain medicine, you don't use them all, they're sitting around the home, biggest thing is dispose of them.
And is there anywhere we can dispose of them?
Local police departments, you can dispose your medications, and also some pharmacies. But all the local police departments in Macomb County, you can drop off your medications and dispose
They'll
of them.
take care of them? So what is being done to help curb the issues with addiction here?
Biggest thing is increase awareness. The U.S. Surgeon General just came out with a report this past week that's comparing it to like smoking back in the 1960s when they increased awareness. Just so people realize that it is an issue. You know, 2014 saw the most overdose deaths ever. So it's so common, such a big epidemic. They just want to increase awareness, make sure people are aware of it, and look for signs. You know, if your child or something may be exposed to these type of medications.
And what signs can we look for?
Well, change of behavior. You know, if they're in high school, maybe their grades are slipping. Things like that, or a new sort of, new group of friends. Those are some of the telltale signs.
Well, we certainly appreciate you coming in today and helping our viewers understand a little bit more about addiction and how to help our children or family members out with that problem. Thank you for coming in, and we look forward to talking to you soon.
Thanks for having me.
Okay, thank you.